Hello and welcome to 5 Minute Pharmacology. Today we're going to be discussing the drug Ondansetron. Ondansetron's trade name is Zofran. Its classification is an antiemetic agent, and it's carried 4 milligrams in 2 milliliters and 4 milligram oral dissolving tablets. Then we carry two of each of these in our drug boxes currently. Some pharmacology and actions behind how Zofran really works is it selectively blocks serotonin 5-HT3 receptors in the brain. It does not have a direct effect of dopamine inhibition. Therefore, it doesn't cause these things called extrapyramidal um, symptoms or reactions, which is basically uncontrollable movements of the eyes, the neck, a protruding tongue, different things like that. Typically, you'll see these extrapyramidal reactions for patients who have just started like antipsychotic drugs, and they can happen in a pretty moderate percentage of these patients who are starting to take those type of drugs. But ondansetron or Zofran won't cause these things to happen, and its primary effect is in the GI tract. So the indications is for patients who are nauseated or vomiting. Just remember oral dissolving tablets. If they're really vomiting a ton, I would probably not choose the oral dissolving route and go for um, a different type of route other than oral ingestion, because the patient may just throw that right up if they ingest that medication. So, some contraindications with the patient is patients with prolonged QT intervals, patients less than 1 month old, and an allergy. So, going back to the QT prolongation, you really want to be careful with using um, ondansetron with patients that have prolonged QT syndromes, and we don't want to give this medication to prolong the QT even further, causing lethal dysrhythmias. However, some studies have shown that typically, like QT prolongation, where it becomes very serious, is at doses upwards of 32 milligrams, where we most likely won't be getting to that high level of administration of ondansetron, but be cautious of this. Administration, IM, PO, or sublingual, 10 to 30-minute onset time. Peak effect is 1.5 hours, and duration is 8 hours long. We give this for patients who have nausea and vomiting, and the dose is 4 milligrams. I hope you learned something about ondansetron. Thank you for listening.